Hey guys, welcome back to our series of case-based scenario. In this video, we are going to see about an interesting syndrome, that is cleft tongue syndrome, from the subject oral biology, and this is Dr. Janvi. So let's begin with our topic now. So what is a cleft tongue syndrome? So as you can see from the name itself, cleft tongue, that means that the tongue is having a cleft in it. So what all it involves, let's just see. So it is also known as glossopsychis, left tongue syndrome, and also as bifid tongue. So it has a split running along the length of the tongue, that is, the tongue might look like this. Okay, so it is the result of incomplete fusion of the distal tongue buds. So this is important. So a bifid tongue may be an isolated deformity and has also been reported to be associated with maternal diabetes. Sometimes with maternal diabetes, bifid tongue is associated. Prenatal ultrasound sometimes detect the presence of cleft even before the birth. The cause is originally not known and cannot be prevented, but sometimes exposure to certain viruses or drugs during pregnancy may cause the cleft tongue. So the biggest problem is difficulty in eating. Of course, with cleft tongue, it is really very difficult, right? So most of the time, a cleft tongue can be fixed by surgery up to several months after birth. So other than this, children with cleft tongue lead a normal life. Okay, so the most important thing, you have to remember the names, the other names, glossopsychis, cleft tongue syndrome, or bifid tongue are all the same. It might be associated with other symptoms or it can come alone itself. So it is most commonly associated with maternal diabetes, and it results from incomplete fusion of the distal tongue buds. So the biggest problem is only difficulty in eating. It can be surgically modified after birth for up to several months. Okay, so sometimes even prenatal ultrasonography can also detect the cleft. Okay, so and apart from this, the child with a cleft tongue can lead a normal life. Then, so how is it formed? So from this image, you can just see the embryology of tongue. So this is the lingual swellings, and this is tuberculum impar, foramen cecum, and cupola. So as you know, the anterior two-third of the tongue is formed from the lingual swellings and also tuberculum impar. Okay, the anterior two-thirds of the tongue is formed from lingual swellings and tuberculum impar, whereas the posterior one-third of the tongue is formed from cupola. Okay, the foramen cecum remains as it is. Okay, so that is a brief about the embryology of tongue. So the tongue develops during the 4th week of intrauterine life. So this is very important. So it develops from in the 4th week of intrauterine life, originating from the median swelling, the tubercular impar on the floor of the pharynx, and also the two lateral lingual swellings joining in the central structure. So these lateral lingual structures grow rapidly to cover the tuberculum impar to form the anterior two-thirds of the tongue. So as you have seen before. So here in this image, you can see the baby with the cleft tongue, right? So when the process is disturbed, that is, when these two lateral lingual swellings are not getting fused properly, the tip of the tongue is divided longitudinally for a certain distance, giving rise to a cleft tongue or the bifid tongue. The occurrences of bifid tongue in the absence of other orofacial abnormalities is a rarity by itself and is usually receives attention much later compared to those seen in association with certain syndromes. Okay, then coming to a clinical scenario now. So an infant is brought to a dental clinic due to problem in suckling. On intraoral examination, the tongue was bifid. The probable cause for the development of such pathology is due to failure of fusion of the two lateral lingual swellings. Okay, so that is the answer. If you like our video, do subscribe to our YouTube channel. You can also like, share the video to your colleagues and friends. You can also follow us on our Instagram handles, that is DOCSHAALA for dental content and DOCSHAALA medical for medical content. You can also follow us on Telegram. Thank you.